student?
ନା ମ୍ୟାମ୍ ଆକ୍ଚୁଆଲି ଟିକେ ଡ୍ୟୁଟି ସେଡ୍ୟୁଲ ପାଇଁ ମୁଁ ବିଜି ରହିଯାଇଥିଲି ତ ଜଏନ୍ କରିପାରିନଥିଲି।
Okay. Okay. Yesterday, I already discussed about the different types of study, that is the descriptive study and analytical study. Today, I will discuss about the design strategy in research analytical study. In this, first I will discuss about the what is the observational study and a cohort study, case control study, analytical cross-sectional study, and what is the intervention study and the experimental study. First, I will discuss about the analytical study. What is analytical study? In analytical study is the second major study of the research methodology or the research epidemiology. In this second type of epidemiological study, in this analytical study, we will discuss about the mainly the subject of interest is the individuals or the small groups of individuals in control to descriptive studies, where the researchers deal with the observation. That is the analytical study, and this analytical study is the second major study of the epidemiology. In this analytical study, first it is mainly broadly divided into two types. One is the observational study and the another one is the descriptive study. Again, this observational study again divided into the descriptive study, analytical study, and the randomized study. First, I will briefly discuss about the what is the analytical study. In the analytical study, it is mainly divided into two types. One is the case control study, and the another one is the cohort study. First one is the in the analytical study, we will discuss first I will discuss about the case control study, and the second one is the cohort study. What is the case control study? From each of these study, from both in the case control study and the cohort study, from the each of the study design one determine whether or not a statistical association exists between the disease and the suspected factor. If one exactly the strength of the diseases. What is the case control study? Case control study is nothing. Case means the in case control study, case means the person is having the disease or the if the person is having the problem of the any kind of disease, then that is called as the case. In control case in control means the person is not having any kind of disorder. That means the person is merely absent from the any kind of disease, that is called as the control. What is the case control study? In the case control study, mainly a common for approach to test the causal hypothesis. What is hypothesis? Hypothesis is nothing. Hypothesis is the supposition. Hypothesis is the supposition. And this case control study mainly a common fact approach to the test the cause of the hypothesis, and mainly this case control study is used to know the cause of the diseases. By using the case control study, we will find out the first what is the cause of the disease and the experiencing and the experience of the diseases also. And mainly the name, case reference, and the retrospective or the prognostic study. This case control study is otherwise called as the retrospective study or the prognostic study. It is very distant feature. Both exposure and the outcome of the have occurred before the onset of the study. And this type of case control study, the study proceeds backward from the effect to the cause. After the occurrence of the disease, in this case control study, we have to move to the from the diseases to the backward. That's why it is called as the retrospective study. And the use of the control or the comparison groups to support on inference. And now I will discuss about the basic study design. What is the basic study design? The basic study design means, first, in this case, we will take the we will choose from the large number of population. We have to select the peoples with the disease. That means the oral cancer, the people with the disease means that that in that group you have to choose the person that are having the problem of the oral cancer. In the another case control group, people without the disease. That means that people without disease means that they are having the problem of the oral cancer. In the population also, the mainly in the people with disease, those who are having the oral cancer, they are exposed with a very risk factor. That means they are having the they will taking the regular basis, they will consume the any kind of unhygienic food. Otherwise they will regular basis they will taking the or chewing the tobacco. That also the main cause of the carcinoma. And another group is not exposed without respecter, means non chewing tobacco. That group we also selected. What is the basic steps in the case control study? For the what is the major basic step for the case control study? I already discussed about that, what is case and what is control. Case means that person having the problem of the disease, that is the person is having the disease, that is called as the case. And in control the person that they are not having the problem of the any kind of diseases. That means merely absence from any kind of diseases is called as the control group. Case means the person is having the problem, that means the person is affected by any kind of disorder, that is the case. But in control case, that person is not affected by any kind of diseases. What is the basic steps in case control study? The basic steps of the case control study is the selection of the case control study. Then second step is the matching. And the third one is the measurement of the exposure. And the fourth one is the analysis and the interpretation. Fourth point is your in the step of the case control study. First one is the selection of the case and studies, case control. Second one is the matching of the different groups. And third one is the measurement of the exposure. And the fourth one is the analytical and the interpretation. These 4 points are the basic step in case of the case control study. And what is that case and what is that control? Case define the case. For the defining case, now first you have to we will go for the some investigation like the diagnostic criteria. That means the disease and the stage of the diseases must be specified in the cases. First I will discuss about what is the case. In case now, if we will go through the case, then first you have to go through the diagnostic criteria. In diagnostic criteria, first the case means all of you know that that person is having the disease. For the disease, for the finding of the all the whether that person is affected by the what type of disorder, first we have to go through the different types of pathological investigation and what the physiological changes occur after the occurrence of that disorder. Due to that only diagnostic criteria is very vital for the case studies. What is the diagnostic criteria? In the diagnostic criteria, mainly disease and the stage of the disease. Stage of the disease must be specified. And then we have to move towards the eligibility criteria. And what is the sources of the disease? Where we will be got the sources? Case you can get from the hospital. Where we will get the case? Disease person আমি কোটি পাইবা from the hospital only. Yes or no?
Yes.
Otherwise in the groups also, otherwise in the basti area re madhye jaiki we will collect the cases also. If we will consider, if we will be start our research in the slum area, then we will first we will choose one kind of disorder like the cholera or the dysentery. Then first we will first collect the data from the very slum area where the maximum people are affected by the cholera or the diarrhea, and from there you have to collect the data. Either you have to the case you get either from the hospital, otherwise you can from the any peripheral area where the suspected persons may be affected by the any kind of disorder. And what is the control? Control means the person who have not disease, the person who are not having any kind of disorder, that is called as the what? Control. Rajlakshmi,
Yes, ma'am.
ବୁଝି ହଉଛି ନା?
Yes, ma'am.
ଆପଣ ତ କାଲି ବୋଧେ ଲାଷ୍ଟ କ୍ଲାସରେ ନଥିଲେ ନା?
ନାଇଁ ମ୍ୟାଡାମ ନଥିଲି, କାଲି ଟିକେ ମାନେ ନଣନ୍ଦଙ୍କ ଭାର ଆସୁଥିଲା ତ ମୁଁ ଗାଁକୁ ପଳେଇଥିଲି।
ଆଚ୍ଛା, ଆ ପୂର୍ବରୁ ଆପଣଙ୍କୁ ମୁଁ ବ୍ରିଫଲି ପଢେଇଛି ଡେସ୍କ୍ରିପ୍ଟିଭ ଷ୍ଟଡି କଣ ଏଣ୍ଡ ଏପିଡେମିଓଲୋଜିକାଲ ଷ୍ଟଡିଜ କଣ, ଆନାଲିଟିକାଲ ଷ୍ଟଡି କଣ, ତ କ୍ରସ୍ ସେକ୍ସନାଲ ଷ୍ଟଡି କଣ। ତ ଆମକୁ ଆପଣ ମାଷ୍ଟର ଡିଗ୍ରୀ କମ୍ପ୍ଲିଟେଡ ହେଲା ପରେ ତ ଆପଣ ମାନେ ଆଗକୁ ଯାଇକି ନିହାତି ରୂପେ ଆମମାନଙ୍କୁ କାହାକୁ ନା କାହାକୁ ଗୋଟେ ରିସର୍ଚ୍ଚ କରିବା ପାଇଁ ଆମେ ଇଣ୍ଟରେଷ୍ଟ ହବା। ତ ଫର ଦ ରିସର୍ଚ୍ଚ, ଇଫ वी थिंक अबाउट द रिसर्च पॉइंट ऑफ व्यू ना, तो these subject, these statistics and research methodology is the very vital subject. आपण माने जदि ए रिसर्च सब्जेक्ट को हमें ठीक से न पढ़िबा, ठीक से न जानिबा, ताहले हमें पीएचडी किबा आपण नेट क्वालिफाई करी किछि भी करि परिबे नहीं. That's why this subject is very vital in each and every point. आपण नेट दियंतु कि पीएचडी रो प्रिपरेटरी एंट्रेंस भी दियंतु, जहां भी दियंतु, आपण को एथरो ही आपनकर 40 ରୁ 50% क्वेश्चन आछिबा. बुझी होची?
Yes, ma'am. ଆପଣ ଆରଥର କହୁଥିଲେ
हाँ, तो
ରିସର୍ଚ୍ଚ
आपण
ପେପର ପାଇଁ ଗୋଟେ ଲେଖୁ।
बहुत इंपोर्टेंट, कारण आपण तो जेहेतु मास्टर डिग्री करूछंती, मास्टर डिग्री पर तो निहाती रूपे इच्छा हम हमको केनटी के पीएचडी करबा, हम रिसर्च करबा, तो सेहिति पई बोली आपनकर एई पेपरटा बहुत वाइटल। तो मु जेतकी जहा पढौची आपण एटलीस्ट सेतिकी पढंतु, तो एग्जाम पॉइंट ऑफ व्यू रे भी आपण पे बहुत वाइटल। एलॉन्ग विथ दैट आपण जदि आगो को जाय कि रिसर्च भी करिवे, तो एगुडा को निहाती रूपे दरकार। एतिकी जदि आपण न जानिछंती, आपण रिसर्च रो किछि जिंस ही जानि परिबेनी। हाइपोथेसिस कौन, रिसर्च कौन, क्रॉस सेक्शनल स्टडी कौन, डिस्क्रिप्टिव स्टडी कौन, एनालिटिकल स्टडी कौन, केस कंट्रोल कौन, बुझीला ना। तो एटलीस्ट आपण माने क्लास रे टिके टिके सुनिले, तापर निजे निजे टिके पढि देले हेइ जिवो। ओके।
Yes, ma'am.
राकेश,
Yes, ma'am.
बुझी पारुछ सबु?
हाँ, ma'am.
Now I will discuss about the what is the case control study. In the control is the crucial step in case control study. Control must be free from the diseases under study. That means very similar to the case, except for the absence of the disease under the study. In this case control study, the comparison group is identified before a study is done, and for to select the comparable control can introduce bias in case control, and the sources where we will be collect the data from the hospital side or from the periphery. From these two sides we will collect the data. And in analytical this analytical epidemiology, first one is the cross sectional study. In the cross sectional study, the first component is the study started about the total population. Cross sectional, जितो हमें cross sectional study करिबा, सेठी हमें होल पॉपुलेशन को नहीं कि गोटे ग्रुप ऑफ पॉपुलेशन को नहीं कि सेठू हमें कौन करिबा, डाटा कलेक्शन करिबा. द स्टडी फ्रॉम इन द क्रॉस सेक्शनल स्टडी, analytical study again divided into cross sectional study, then case control study, and third one is your cohort study. बुझिला?
Yes, ma'am.
Yes, ma'am.
हमारो जो analytical study रही, analytical study is the second major epidemiological study. First one is the descriptive study. In the last class I already discussed about the descriptive study, and the second one is your what? Analytical study. In these analytical study again divided into three types. One is the cross sectional study, second one is the case control study, and the third one is your cohort study. बुझिएला? तक पर्यंत बुझिएला?
Yes,
Yes,
ma'am.
ma'am.
आपण न बुझी पारले मु आगु को जीविनी, बुझी न पारुछंती मते कहिबे, मु बार बार कहूची दिस सब्जेक्ट इज वेरी वाइटल फॉर यू. एई सब्जेक्ट गोटे थेरापेटिक न्यूट्रिशन गोटे, बुझिएला? बुझी परछंती? क्लिनिकल न्यूट्रिशन जोटा आपनकर जो
पढ़ाई
थेरापेटिक पार्ट
सारी
क्षेत्र अछि. हां,
पढ़ाई सारी।
Exactly.
Therapy
ମୁଁ ତ ପଢିଥିଲି ନା, ହଁ ମୁଁ ପଢିଥିଲି ସେଇ ପେପର, ଏଇ ପେପର ବହୁତ vital. Then what is that cross-sectional study? That cross-sectional study is the first component. The study mainly started about the total population. How many people are suffered from the diseases? From a group of population, we have to select how many people are suffering from the diseases. In this cross-sectional study, one is the incidence and the another one is the prevalence. In the cross-sectional study, you remember these two words. One is the incidence and the second one is the prevalence. What is that incidence? Incidence is the type of rate, means the new cases. Okay, type of rate means the new cases. That is the new cases of disease, that is the incidence. What is the prevalence? In prevalence means the new and old cases. Talking about the prevalence. আমি যেটা in the cross sectional study we have it combines with the incidence and the prevalence. In the incidence only, the type of mainly we will got the very new cases only, but in the prevalence type na, the new and old cases is there, and that is the prevalence. What is that cross sectional study? Cross sectional study means new plus old cases. Talking about the prevalence, it is called as the snapshot of total population. Snapshot, that is called called as the cross sectional study. And the second one is the case control study. In the case control study, I already discussed about the case control study. What is case and what is control? Case control study mainly the past history of the patient. In the case control study, we have to study about the past history of the patient and the all data present in front of you. While you are collecting the data in front of the patient, you can sit and you can collect the data very easily. In this case control study is otherwise called as the retrospective study. You remember this point. Case control study is otherwise called as the retrospective study. And in the case control study, the person with the disease could be compared with the person without the disease. आमे एटी ग्रुप ऑफ पॉपुलेशन रु नै कि आमे सेइटु जो पर्सन मानकर डिजीज थिबो, दे आर हैविंग द प्रॉब्लम ऑफ द कॉम्प्लिकेशन ऑफ द डिफरेंट टाइप ऑफ डिजीज, एंड तांको सहित आउ गोटे ग्रुप पॉपुलेशन को आमे नबा जो मानकर दे आर नॉट हैविंग एनी काइंड ऑफ डिजीजेस, and the person with the disease could be compared with the person without the disease and the characteristic associated with the condition identified. बुझी होची?
Yes, ma'am.
Yes, ma'am.
And this case control study we will call as that it is the retrospective study, and it is otherwise called as also the Hawkins study. Mainly if you will the example of the cross sectional that case control study is the diabetic. Diabetic means what? Those who are having the problem of the obesity is the risk factor. That means take one person who is having the diabetic mellitus, that person may be affected by the obesity also. Then we will go into the past history of the patient, and past history before we will means go through the disorder. First we will first collect the data about the past history of the patient, how many years he is having the problem of the obesity, and since how many years he is having the problem of the hyperlipidemia or any kind of blood lipid profile will be increases or decreases at that time. You have to collect the data from the backward to the present situation. That type of study is called as the case control study. Understood? गोटे डिजीज को आमे रिसर्च कला बेलू आमे ताकू रिसर्च कला बेले जो केस कंट्रोल स्टडी रे आमे कोन करबा, प्रथमे गोटे डिजीज पई गोटे पॉजिटिव ऑर्गेनिज्म जेमति जो माने इफ दोज आर हैविंग द प्रॉब्लम ऑफ द डायबिटिक मेलाइटस, तो आमे सेठी देखिबा ओबेसिटी दे आर वेरी प्रोन टुवर्ड्स द डायबिटिक मेलाइटस. तो ओबेसिटी जेते बेले से थिला केते वर्ष ले से ओबेसिटी अफेक्टेड हेतिला, एंड दैट टाइम देयर से चेक करथिला कि नै थारा ब्लड सुगर फास्टिंग ब्लड सुगर हो, पीपीबी पोस्टपांडियल ब्लड सुगर हो किंबा आपनकर HbA1c हो, अदरवाइज अदर लिपिड प्रोफाइल वैल्यू आल्सो लाइक तारो VLDL केते थिला, LDL केते थिला, HDL केते थिला. तो आमे कौन करिबा पेशेंट रो पास्ट को जाय कि पास्ट को इन्वेस्टिगेट करिके देन वी हैव टू रीच टू द प्रेजेंट सिचुएशन और द प्रेजेंट complication of the patient. That type of study from past to the present type of study of the condition of the patient. So, and the cause of the diseases, that is called as the case control study. All of you are clear about this?
Yes, ma'am.
Yes, ma'am.
Sridhatya, Sridatri,
Yes, ma'am.
आज लेट रे जॉइन करलो
मैम मोर नेटवर्क प्रॉब्लम टिके थिला तापरे आउथरे माने स्विच ऑफ करिकि तापरे देन स्विच ऑन करिकि कर
ओके
नेटवर्क थिला
एठी तमे सुनो जहा न बुझी छ तम पिला माने अदर पिला माने अछन जरे तमे टी पढिबो तो आमे भी जानि पाले व्हाट इज केस कंट्रोल स्टडी इन द केस कंट्रोल स्टडी मेनली this the person with the disease could be compared with the person without the diseases and the characteristic associated with the condition identified. And these type of diseases, in this type of study, no incidence, no prevalence. Okay, and it is inexpensive, easily carried out. Because एथिरे हमको कौन सी प्रकार लैब इन्वेस्टिगेशन ता परे आ किछ करे दरकार ना प्रीवियसली हमें जेतु हिस्ट्री नउचन इट इज inexpensive and it's also very easy to carry out the study. Okay, like past history, we are going to the past history of the patient, whether on the increase of the sugar level, otherwise increase of the TG, triglycerides level, or that person is having the family history of diabetic. तो ए सब जिनस कला बेले हमें पास्ट हिस्ट्री रो प्रेजेंट कॉम्प्लिकेशन पर्यंत आछंती दिस टाइप ऑफ स्टडी इज कॉल्ड एज द केस कंट्रोल स्टडी. All of you clear about the case control study?
Yes, ma'am.
Yes, ma'am.
Then third one of analytical epidemiological study is the cohort study. Third study is your cohort study. In the cohort study, na, the risk factor mainly diseases going towards the future. आमे सेठी आमे देखो सिंपल जिंस आमे केस कंट्रोल स्टडी रे आमे कॉज को जाउचंदी कॉज रो प्रेजेंट सिचुएशन कॉज गोटे कॉज नथिले गोटे डिजीज आसेनी जेमती की एंड दैट कॉज तार बहुत सारा एसोसिएटेड फैक्टर इज रिस्पांसिबल फॉर दैट. यस और नो जेमती जदि आमे डायबिटिक कथा चिंता करबो ओबेसिटी भी हेई थाए लाइफस्टाइल इनबैलेंस पय हेई थाई पारे अदरवाइज ड्यू टू इनटेक ऑफ ड्यू टू द सेडेंटरी लाइफस्टाइल हेई थाई पारे किबा डायबिटिक ता हेरिडिटरी हेई थाई पारे other consumption of high glycemic index food, that is also the cause of the diabetic mellitus. So from the cause to the disorder पर्यंत हमें जहाँ study करिवा that is called as the case control study. But in the cohort study we have to move towards the future after the affected of the disease, from disease to what is the co-complication and what is the comorbidities and what happen after the affected of the disorder. हमें जहाँ हमें पढ़िवा that is called as the cohort study. All of you clear?
Yes, ma'am.
बुझिलानी?
Ma'am, please repeat once again.
Okay, in the cohort study, mainly the risk factor is the disease going towards the future. Means forward losing from the go towards the future. Study in this type of study na prospective study or the looking forward study. हमरे जहाँ आगुरु हेची जहाँ present अच्छी ता परे आगु को जाके हम स्टडी करिबा जेमति डिजीज रे डायबिटिक हे गला तो आफ्टर अफेक्टेड ऑफ द डायबिटिक up to the diabetic, the cause of the diabetic, what is the responsible factor for the diabetic, what is the etiological factor of the diabetic up to the diabetic point, that is called as the case control study. But in the cohort study, what is the after the affected of the diabetes mellitus, what is the co-complication arises after the affected of DM, diabetic mellitus. There are so many complication arises after the after the effect of diabetic, like the diabetic peripheral neuropathy is there, and cardiomyopathy is there, and also retinopathy is there, and nephropathy is there. These all are the co-complication of diabetic mellitus. तो एटा केतेबेले हैला डायबिटिक हैला परे इन फ्यूचर दैट विल बी नॉट अकर सडनली आफ्टर द डायबिटिक आफ्टर द पेशेंट इज हैविंग द प्रॉब्लम ऑफ द डायबिटिक इट विल बी नॉट अकर very immediately very instantly it may be very slowly it will be progress very slowly and slowly in future that person may be affected by the all these types of complication and that type of study is called as the cohort study बुझिएला
Yes, ma'am.
पुष्पांजलि मैडम बुझी होची ना
Yes, ma'am.
Yes, ma'am.
हाँ माने गोटे थर आमे जोटा एटियोलॉजी रो जो पर्यंत डिजीज पर्यंत पहुंचुंती सेटा केस कंट्रोल स्टडी जेतले आमे आगु को बढ़ुचंती बुझिले जो को कॉम्प्लिकेशन होची डिसऑर्डर रो दैट इज योर व्हाट कौन
Cohort
सेटा
study.
cohort study okay and this cohort study is the it is otherwise called as the cause and effect means cause कारण को भी हमें देखिबा and after the affected of that disease what is the effect of that disease once diabetic हैला पर तार side effect तार complication कौन कौन को complication है कि कौन कौन हमको problem होची that is the cohort study and mainly what is the outcome of the disease after 10 years आमे ताको कौन करिबा स्टडी करिबा बुझिला एटा तो आमे मु खाली कहूची डायबिटिक मेलाइटस एमती कि आपण माने देखिथिबे जदि माने करो एचआईवी इफेक्टेड हेचंती एड्स हेची तो इमीडिएटली हमर कोन से साइन सिम्पटम्स हमर देखा जाएनी आफ्टर 5 years 10 years when the body vitality will be decreases slowly at that time only the complication will be arises more and more at that time you can see the patient and the patient is having so many complication at the when the disease will be progress at that time will be the complaint will be more and that type of study is called as the cohort study बुझिएला
Yes, ma'am.
that is called as the cause and effect cause and effect means गोटे disease हैला पर तार cause कौन and तार effect मध्य कौन बुझिएला cause and effect it is also called as the cause to effect study and follow up is very important in this type of cohort study now we have to follow up the patient in the regular basis is very vital and smoking follow up every month that means if the person is having the lungs carcinoma after the smoking of 10 years that person may be after the 10 years smoking the person is having the problem of the lungs carcinoma at that after the positive case of carcinoma first we will be go through the cause of the disease after that we have to check the patient in the regular interval we have to follow the patient in the regular interval that type of study is called as the cohort study and follow up the study is about the static from the risk factor only and it could be present or not then types of cohort study. There are mainly two types of cohort study. One is the prospective study and the another one is the retrospective study. You remember all these words. In the cohort study, again it's divided into the first one is the prospective study and the second one is the retrospective study. And the prospective study, mainly the concurrent cohort study is otherwise called as the concurrent cohort study and the retrospective study is otherwise called as the historical cohort study. बुझिएला
Yes,
Yes.
ma'am.
सिंपल जिनस कोहॉर्ट स्टडी को डिवाइड करा हिची गोटे होची तमनकर पर्सपेक्टिव स्टडी एंड अनदर वन इज द रेट्रोस्पेक्टिव स्टडी पर्सपेक्टिव स्टडी होची अदरवाइज इट इज कॉल्ड एज द concurrent cohort study but retrospective study को कहा जाउची historical cohort study सरला understood
Yes, ma'am.
Yes, ma'am.
example दोटी यदि 50 diabetic patient going to beg for the pathological investigation for data went to the for the collection of data we have to went to the hospital where we will be collect the data and we will finding some things from the hospital only and that That is called as the retrospective cohort study. We will go back to the study, then the community and the future. That is the what? First, ଆମେ ଯୋଉଟା disease ଜାଣିଲେ, disease ପରେ disease को confirmation हवा पाई, ଆମେ तार सबुतक से को हॉस्पिटल एडमिट ହେଇଥିଲା and तार सेही समय कंडीशन कोन थिला पूर्वठु एबे पर्यंत जो जिनसटा ଆମେ आनिबा ताको कुआ जीव तमर रेट्रोस्पेक्टिव स्टडी एंड आगु को जो बढ़िबा देन फ्यूचर वंस डिसऑर्डर हैला पर तापर जो कॉम्प्लिकेशन आसे दैट इज कॉल्ड एज द रेट्रोस्पेक्टिव prospective study back to the past and present to the future study. The total combination is called as the cohort study. And the examination mainly I mean example if one patient is having the problem of the heart disorder, in that heart disorder now what will happen now after 10 years, what will happen, there will be so many kinds of pathological and physiological changes occur inside the body. तो आमे तो कौन करवा ऑब्जर्वेशन रखिबा. This type of study is called as the what? That को स्टडी बिले हम कहबा एबे को विषय हम पढु चंते
Coherent study.
cohort
Cohort,
study. Okay,
cohort study.
cohort study, very good. एग्जांपल होची आमे डायबिटिक को भी नहीं परिबा, हार्ट को भी नहीं परिबा, बिकॉज़ डायबिटिक रो आगुर कोन कॉम्प्लिकेशन माने कोन होची केमिति होची एटियोलॉजी को धरिबा, देन फ्रॉम द डिजीज हैला पर तार को कॉम्प्लिकेशन कोन होची ताको मते देखिबा. नाउ आई विल डिस्कस अबाउट द डिजाइन ऑफ द कोहोर्ट स्टडी. कोहोर्ट स्टडी रो डिजाइन केमति आमे करबा. फर्स्ट प्रेजेंट टू द फ्यूचर स्टडी इज द कोहोर्ट स्टडी. मैं प्रथम रो कहली प्रेजेंट में कोन अछि एंड आगु को हमरो को कॉम्प्लिकेशन रे कोन एराइज होची, दैट इज योर कोहोर्ट स्टडी. Means population without the disease. That means in population without the disease means the person may exposed might develop the disease, and that non-exposed means जो माने हमरो exposed हेबे नि, they are not might not develop the disorder. Forward direction means looking forward the study, going to the present to the future. That is the design of the case control study. Design of the case control study or design of the cohort study means from the disease to future condition. If we will study, then that is called as the design of the cohort study or forward direction study. Looking forward study, it is otherwise called as the looking forward study. People from the disease going towards to the cause to the future effect. People with disease, people without disease, they might be exposed or might not be exposed to the causative organism. And case control study, cohort study, cross product ratio study. Case control study and the cross product ratio study. Case control study means strength of association risk disease factor and the disease. That is the case control study is called as the retrospective study. Example, cancer. Any risk factor, that may be smoking may be cause the cancer, or you might say the risk factor is not present, either cancer was present, cancer was not present. Means if we will consider about the एमती नुह जे जो माने समस्त जेतिकी लोक एमती नुह जे जो माने स्मोकिंग करचंती, जदि हम 100 डाटा नउचंती बा 50 केसेस को हम नउचंती, आउट ऑफ दैट 50 ରୁ 50 जाक समस्तंकर कार्सिनोमा हेइ जाउछि. सेइथिरु मध्य एमिति लोक अछंती जो माने को 50 जदि हम डाटा नउचंती, आउट ऑफ दैट 30 लोकंकर कैंसर हेइ जाउछि, बट आउ 20 लोकंकर किछि होनी, बिकॉज़ सेटा टोटली डिपेंड करछि बॉडी रो वाइटलिटी ऊपर किबा अदर एसोसिएटेड फैक्टर इज आल्सो देयर. माने कदा हम चारटा ग्रुप पॉपुलेशन रो चारटा ग्रुप कर दिजन, चारटा ग्रुप रो गोटे ए ग्रुप ए बी सी डी. जदि क्रॉस सेक्शनली हम देखिबा, ए जदि डी ऊपर डिपेंड करछि एंड सी जदि बी ऊपर डिपेंड करछि, देन हाउ मेनी पर्सन हैव द रिस्क फैक्टर डेवलप द कैंसर, हाउ मेनी पर्सन दैट रिस्क फैक्टर बट नॉट डेवलप द कैंसर जो मानकर सब बेले बैलेंस स्टेट रे थाए से मानकर एते दे आर नॉट प्रोन टू फॉर द कैंसर और वेरी प्रोन टुवर्ड्स द एनी काइंड ऑफ फैटल डिसऑर्डर. Cohort study. In the cohort study, three important component is there. In the cohort study, three important component is there. One, the factor. First one is the relative risk factor. That relative risk ratio factor. What is that RR? RR means relative risk ratio. That is the incidence of exposure divided by the incidence of non-exposed. That is called as the relative risk. But it is in the it is denoted as the RR. What is RR? Cohort study जो रही cohort study the factors से हमारा mainly तीन प्रकार three important factor is there, component is there. One is the RR. RR means relative risk ratio. RR is equal to incidence of the exposed divided by the incidence of the non-exposed. Incidence of exposed जो माने बहुत exposure होती है for the causative माने for the disease पाई बोली divided by the non-exposed incidence of the non-exposed. So that is called as the RR. It is otherwise called as the relative risk RR. And the second component of the cohort study is the attributary risk. Attributary risk is denoted as the AR. The second component of the cohort study is the AR. First one is the RR. RR is the incidence of exposed divided by the incidence of the non-exposed. आम यदि डिवाइड करबा जो माने वेरी एक्सपोज्ड फॉर द डिजीजेस इंसिडेंस ऑफ द एक्सपोज्ड डिवाइडेड बाय द इंसिडेंस ऑफ द नॉन एक्सपोज्ड जोटा आसीबो सेटा होची रिलेटिव रिस्क बा इट इज डिनोटेड एज द आरआर. इट इज द कंपोनेंट ऑफ द कोहोर्ट स्टडी एंड द सेकंड कंपोनेंट ऑफ द कोहोर्ट स्टडी इज द एआर एंड द थर्ड कंपोनेंट ऑफ द रिस्क ऑफ द कोहोर्ट स्टडी इज द पीएआर. मने रहिला कोहोर्ट स्टडी रो
मैम
तीनटा
थर्ड
कंपोनेंट सह
कंपोनेंट कौन?
कहूँ आउ थे
थर्ड
डिटेल्स कहूँ कोहोर्ट स्टडी रो जो कंपोनेंट्स रही डिवाइडेड इनटू थ्री टाइप्स. वन इज द आरआर, सेकंड वन इज द एआर एंड द थर्ड वन इज योर पीएआर. आरआर I already told about the RR. RR is the relative risk. RR, the incidence of the exposed divided by the incidence of the non-exposed is called as the what? Relative risk. And what is this AR? AR is the attributary risk. AR is the attributable risk. What is this AR? AR is the attributable risk, and that attributable risk is the incidence of exposed population minus incidence of non-exposed population divided by the incidence of exposed population multiplied by 100. That is called as the attributable risk. बुझिएलानी बोधे किछि?
मैम आरए
आउथर
टिक
AR, not RA. AR. Okay. AR is the attributable risk. What is that attributable risk? Attributable risk means incidence exposed population minus incidence non-exposed population divided by incidence exposed population multiplied by 100. That is called as the attributable risk. बुझिएला?
यस मैम.
Now repeat करिवे.
यस
आथरे करिवे?
मैम बुझिए
Okay.
ना
And the,
मैम.
and the third one is your PAR. What is PAR? P for population attributable risk. What is that PAR? Population attributable risk. What is that population attributable risk? Population attributable risk is the incidence in total population minus incidence in non-exposed person divided by incidence in total population. PAR is the incidence in total population minus incidence in non-exposed divided by the incidence in total population. That is called as the PAR, PAR or population attributable risk. This is the component of cohort study. And mainly 30% or to 40% risk factor, which is percentage, which is the contributing by the causing the diseases and calculated in the cohort study. That means risk factor, if we will reduce the risk factor of the causative organism, definitely we will decrease the outcome of the disease. Disease will be also decreases. যদি risk factor ଆମ disease ର କମିଯିବ ତାହେଲେ definitely ଆମ disease ହବ ମଧ୍ୟ ଧୀରେ ଧୀରେ କମିଯିବ. Yes or no?
Yes.
And the percentage of the if the percentage declines, na, the outcome variable with the unit change either in the 8% is also means it will be decreases. Now, interpretation of the relative risk odds ratio. What is the interpretation of the relative risk odds ratio? Odds ratio, relative risk. What is odd ratio? Means if we will consider about one condition that having that is 1, and the relative risk factor is equal to 1 also. That means the positive association between the two population. And if the condition is condition of the disease will be less than 1%, means the condition of the patient will be not very good and the chances of recovery is less than 1%. Na? The relative risk factor is also less than here, and there is no association between the two disease outcome also. What is the ecological study design? Cohort study design I already कहली. And what is the ecological study design? Ecological study design means most of the study ଆମେ କୋଉଠୁ କରୁଛନ୍ତି? From the group of population. In the ecological study design, the correlational study and the third party mainly due to source is usually taken, and I will briefly discuss about the ecological study design. Just wait. Oh. बुझी होची जहाँ जहाँ पढ़ौची ना टिके डिफिकल्ट होची रिसर्च मेथोडोलॉजी टिके डिफिकल्ट ही बिकॉज एटा माने अन्य चैप्टर मानक भलिया नुह बट जदि आपण आगो को कैलकुलेशन आसीबो बहुत सारा टेस्ट गुड़ाक आसीबो तो सेउडा टिके टिके जदि जो मानकर मैथमेटिक्स भल होतो कैलकुलेशन भल होतो तांक पई बहुत इजी होबो अदरवाइज आउ ये सब एगुड़ाक मध्य टिके जदि आपण टिके बुझीजिबे निज ओन लैंग्वेज रे भी लिखिबे तो पारिबे किछि एमते असुविधा नै एथि भी पिला माने आराम से 80 90 सिक्वेयर करंती बट जिनस होची बुझीबा निहाती दरकार बुझीबे एंड आपण को ओन लैंग्वेज रे जदि मेंशन करि पारिबे बुझीबाटा होची वेरी इंपोर्टेंट जदि न बुझी पारिबे आपण जेते पढिले भी आपण जानि पारिबे नै जिनसटा बुझी हला
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
in the in specifically ना आमे आज जो पढुचंती आगो क्लास रे फर्स्ट मु पढिथिली एपिडेमियोलॉजी कोन सेकंड क्लास रे काली मु पढौथिली descriptive study विषय details about the descriptive study in the descriptive study I already discussed about the cross sectional study analytical study and other type of study I already discussed about that but today I will briefly discuss about the analytical study and this analytical study ना बहुत important and परीक्षा रे भी एथरे बहुत सारा क्वेश्चन आसी पारे एंड सबटो बड़ जिंस हला जदि आपण माने नेट एग्जाम देबे किंबा पीएचडी पे एंट्रेंस दवा पे जिबे ना तो एथ्रू ही क्वेश्चन आसीबो एथ्रू आपण 40% क्वेश्चन निहाती पाइबे तो एगुडा को सब बहुत इंपोर्टेंट बुझी परछंती जहा पढौची सब बेले सुनंतु गोटे जिंस मने
Yes, ma'am.
रखंतु पाखरे सब बेले गोटे पेन एंड पेपर रखुथिबे या कि आपण जदि पूरा पहिटा सारा भी पढु नांती मु जहा जहा जतिके आपण को ओवरलुक करी करी जाउछि सेतिके एटलीस्ट आपण जदि टिके 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 लिखि दउथिबे तो सेतिक को पढिबे आको बुक को सहित मिले कि एतिकी जदि पढि देबे मतलब कि आपण को सेतिकी भी यथेष्ट बुझी परछन ना नै
Yes, ma'am.
Yes,
ए
ma'am.
प्रैक्टिकल एग्जाम दउथिले ना आपण माने समस्ते
Again.
बेसी भितर को
Yes, ma'am.
जाउथिले माने जिबा होउतला कि से तो सही भितर ही आस्तला ना नै क्वेश्चन तो सेटा तो प्रैक्टिकल बोली चलला बट थ्योरी तो आपण पढिया पडियो ओडा न पढिले किछ नै तो पढिया को पडिबो आपण पाखरे एमती नुह जे मैडम जहा कहउचंदी खाली कान रे सुनिबे एकान रे सुनिबे आर कान रे बाहर करबे से नुह आपण निहाती रे पाखरे पेन एंड पेपर रखंते एंड जहा कहउची ताको टिके लेखिया पई चेष्टा करंत बुझी पाले ना नै गोटे कान खोला थिबो एंड हाथ एपटे चालू थुबो या कि क्लास सरला परे जेबी भी आपण पको मटेरियल्स आपण तो से सब जिंस भितर गोटे पसी माने जाई परिबे आपण टर्मिनोलॉजी ही जानि नथि आपण कोन पढिबे को एते बडो चैप्टर बही की पढिबो ठीक ना मु भूल कहउची
Yes, ma'am.
Yes, ma'am.
राजलक्ष्मी मैम आर यू देयर
Yes.
तो भल से सुनंतु जहा मु पढौची हैला व्हाट इज केस कंट्रोल स्टडी case control study what do you mean by case control study case control study is also the one type of analytical study in this analytical study na in which the person with the disease could be compared with the person without the disease and the characteristic associated with the condition identified that is called as the case control study. The definition of the case control study is that in this type of study it is the case control study means it is the categorization of the analytical study and in which the person with the disease could be compared with the person without the diseases and the characteristic association with the condition identified. That is called as the what? Case control study. Mainly in the analytical epidemiological study, mainly it focus on the determinants of the disease by testing and the hypothesis and formulating from the descriptive studies with the ultimate goal of judging whether a party's exposure cause or prevent the diseases. अगर मैं मतलब एटा ही कहूतिली and the analytical study therefore is the comparative study. Analytical study means it is the having the comparison groups intended to identify and to quantify the association between the hypothesis and identify the case. Case means determinants. And there are various type of analytical study design option which you are there. Mainly the analytical study is divided into the two types of study. One is the experimental study and the another one is the observational study. The analytical study is broadly divided into two types of study. One is the observational study and the experimental study. In the experimental study, the investigator, who is the investigator? The investigator themselves allocate the exposure and then follow the cases for the subsequent development of the disease or the subsequent development of the events. That is called the experimental study. Experimental study means you have to the investigator must themselves allocation the exposure and then the exposure then follow the cases for the subsequent development of the diseases or the events. That is called as the experimental study. But in the observational study, this study, the researchers simply observe the nature, course of the events, that is called as the observational study. And mainly this observational study is mainly used for the analytical study, which investigate the natural course of the event or the diseases. I mean specifically jota observational study re I specifically nature course of the events and the disease ko ame dekhitao observe karitao, and opposed to this an intervention or the experimental study. Okay, this is all about your what is observational study and what is experimental study. Then and this observational study, when the natural course of the event is monitored without any intervention, this observational study may thus be mainly defined as the analytical epidemiological study, in which the observation are made but investigators do not control the exposure or the intervention and other factors also. That is called as the observational study. In this observational study, design mainly divided into three types. One is the case control study, second one is your cross-sectional study, and third one is your cohort study. I already discussed about what is case, what is control, and what is cohort study, and what is cross-sectional study. କହିଛି ନା ନାହିଁ, ବୁଝିଛନ୍ତି ନା ନାହିଁ ଆପଣ ମାନେ?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
ଆପଣ ସେଇ ସବୁ ହଉଛି ଆପଣଙ୍କର କୋଉଥିରେ ଯାଉଛି? Observational study ରେ ଯାଉଛି. All that cohort study, case control study and the cross sectional study comes under the observational study, but mainly the analytical study जो ରହିଛି, analytical study is broadly divided into two types. One is the observational study and the another one is your what? Experimental study. ବୁଝିହେଲା?
Yes,
Yes,
ma'am.
ma'am.
Yes.
And ସେଇଟା ପୁଣି cohort study ମୁଁ ଆପଣ ମାନଙ୍କୁ ବୁଝେଇଛି. In the cohort study, the study means the group of individuals, okay, and they are the basis of the presence or absence of exposure, anemic and non-anemic. If we will consider, if we will take the sample from the group of population and they are having the problem, some of them are having the problem of the anemia, and out of them some of are not having the problem of the anemia, and the subject are then followed up over a period of time to assess the occurrence of the outcome. That means birth weight of the infant. A study following the such a design is called as the cohort study. ମୁଁ କହିଥିଲି ଆପଣ ମାନଙ୍କୁ cohort study ରେ ଆମେ କଣ କରିବା? ତାର past କୁ ଯାଇକି present ପର୍ଯ୍ୟନ୍ତ ଆସିବା ହଉଛି ଆମର cohort study. ବୁଝିହେଲା ନା ବୁଝିହେଲାନି?
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
ବୁଝିଗଲା.
ବୁଝି ହଉନି? କାହାକୁ
ଆଜ୍ଞା
କିଏ
ma'am,
ବୁଝି?
ବୁଝିଗଲି.
ବୁଝୁନି ନା ତମେ
Ma'am,
ନଥିଲ ମାନେ ତମେ
ବୁଝିଗଲି.
join okay, and that note that the data related to the number of the children in the various birth weight categories, the outcome born to these mainly women, because becomes the known only after the data is collected, and this is the natural course since the outcome in any cases occurs afterwards. Such a study may be called as the prospective cohort study. Prospective cohort study means in this type of study now you have to the nature, this is a very natural course since outcome in any cases occur afterwards हेई सरला परे जो गुड़ा आम स्टडी करिबा such a study may be referred to the prospective cohort study जोटा पास्ट को जीबा ताले ताको हमें कहबा retrospective study जदि डिजीज हेबार पूर्वरु जो कॉज एंड इफेक्ट जोटा से कॉज को जीबा ता इफेक्ट पर्यंत आसीबा दैट इज द माने डिजीज कारण को जाई कि हबा पर्यंत आसीबा होची कोन retrospective then disease हला पर जो कॉम्प्लिकेशन होची सेटा होची prospective study बुझी हला
yes ma'am.
Yes, ma'am.
अरे न बुझी पाले मते कुह नले बुझी परची हां कुह किछि न कहले म कोन भाबिबी कुह चुप रहिबी मु भी तम मन भलिया हां व्हाट इज retrospective व्हाट इज prospective study बुझी हला
Yes, ma'am.
yes ma'am.
Yes, ma'am.
मझीटा होची डिजीज रो पूर्व कॉज पर्यंत जीवा होची retrospective अप टू डिजीज पर्यंत पळे असले फ्रॉम डिजीज टू डिजीज हे सला तो विभिन्न प्रकार को कॉम्प्लिकेशन एराइज होची ना दैट इज कॉल्ड एज योर व्हाट prospective study very good And the second one is the case control study. What is that case control study? Case control study I already described about that. And the third one is the case control study. In case control study I already discussed about that. Now I will discuss about briefly about the cohort study. In the cohort study is a very group of people and group of people who share a common characteristic or the experience within the defined time periods, that is the are born, leave school, lose their job, are exposed to the diseases, drugs or the vaccine. That is called as the cohort study. In the cohort study, therefore, is in the epidemiological study that mainly observe a large group of people over a period of time. That is called as the cohort study. The cohort study mainly is a epidemiological study that observes a very large group of people over a periods of time. A group of people or individuals are defined on the basis of presence or absence of exposure to the suspected risk factor for disease, and are eligible participants are then follow up over a period of time to assess the occurrence of the diseases. Okay, mainly in the cross-sectional study or the screening to exclude those with the condition. Reference population free of condition, and then we will collect the sample. After that, we will divide the sample into two categories. The person is having the without the characteristic of any kind of without the symptoms. First, we will categorize without the symptoms of the disease and with the symptoms. That means with the characteristic. Those are having the without the characteristic means then we will again divide it into non-developed condition and the developed condition. But with the characteristic non-developed condition and the developing condition. Then the group of person to be studied are defined in the term of characteristic manifest prior to the appearance of the disease under study. And these defined study groups are observed over a period of time to determine and compare the frequency of study disease among them. आमे जो ग्रुप टाको नैतिबा ताको आमे रेगुलर इंटरवल रे आमे ताको फॉलो अप करूतबा एमती नुह कि गोटे थर स्टडी कले माने आमे ताको छाडी दबा जो माने करो 50 टा population 100 population में आमे 30 पेशेंट नेचन and that 30 patient they are having the problem of the what diabetic जदि अछि तो डायबिटिक हैला परे मेडिकेशन से माने नेला परे मध्य आमे सेमानकर को कॉम्प्लिकेशन कोन होछि कहार जाय कि नेफ्रोपैथी डेवलप हेलानी जेमति कहार पोटासियम बढ़िलानी क्रिएटिनिन लेवल बढ़िलानी एंड सिकेट आड़ी को मूव कलानी आउ कार कार से सब किसी न डेवलप करके रेटिनोपैथी आड़ी को डेवलप करानी तो यही सब जिनस गुड़ा को आम ग्रुप वाइज वी विल बी चेक एंड रेगुलर बेसिस रे वी हैव टू फॉलो दैट केसेस. In the cohort study, in the cohort epidemiological research mainly ना आमे जेमती मने कर आमे CBD कथा देखिबा किबा CAD कथा देखिबा CBD कथा देखिले मने कर कोरोनरी वेसल्स डिजॉर्डर हो किबा CAD कोरोनरी आर्टरी डिजॉर्डर कथा जदि आमे चिंता करिबा तो आमे तांको कोन करिबा डिजीज हे सल्ला परे रेगुलर इंटरवल रे तांको आमे इंटरवेंशन रे रेगुलर इंटरवेंशन आमे तांको फॉलो अप रे रखिबा कोन कोन चेंजेस होउची एट रेगुलर इंटरवल सेटाको फॉलो अप मध्ये आमे करिबा. And this cohort study, mainly this cohort study is very important to that it is classified as either the prospective or the retrospective, depending on the relationship between the initiation of the study and the occurrence of the diseases. The cohort study that may be retrospective, that may be prospective. All these retrospective or prospective that mainly depending on the relationship between the initiation of the study and the occurrence of the diseases. And the retrospective cohort study, the relevant event, both the exposure and the outcome of the interest have already occurred when the study is initiated. But in the prospective study, the relevant exposure may not be occurred at the time the study was initiated. बुझेला कौन रेट्रोस्पेक्टिव कौन prospective?
Yes.
Yes, ma'am.
Yes, ma'am.
What is the advantage of the cohort study? जदि हम cohort study हम करूँ तर कौन benefits कौन? Mainly these advantages of the cohort study can be assess the multiple outcome, that means effect of the single exposure, that is can provide the information on the full range of health effect of a single exposure. If we will go through the cohort study, then it can assess the multiple outcome of the single exposure, and it is very suitable for the study of the rare exposure groups also. And if the perspective is minimized, the potential for the selection bias and the biases in the ascertain of exposure. Cohort study often involves mainly the large number of individuals over a large periods of time. They are generally very time consuming and expensive also. Cohort study is very expensive because आमे एतरे कौन करचंती आगो को पर्यंत कौन कौन को कॉम्प्लिकेशन होची कौन ने मने करो मु डायबिटिक कथा कहूची डायबिटिक रो जति मने करो पेरिफेरल नेफ्रोपैथी होची किबा न्यूरोपैथी होची तो न्यूरोपैथी नेफ्रोपैथी में सबु तक रेगुलर इंटरवल रे हमको बार पैथोलॉजिकल इन्वेस्टिगेशन करिया को पड़िबो. दैट्स व्हाई दिस कोहोर्ट स्टडी इज इनएक्सपेंसिव. एथिरे बहुत पैसा खर्च करिया को पड़िबो. बुझिला what is cohort study, what is cross sectional study?
Yes, ma'am.
Yes, ma'am.
And the case control study mu kahitili case mane kono, the person those who are having the problem of the any kind of diseases, that is the case. But in control the person is not having any kind of disease, that is called as the control. And what is that case control study? The case control study means it is the type of observational analytical study in which the researcher use the subject who already have a diseases or other condition and look back to see if there are characteristics of this subject that differ from those who don't have the diseases. That is called as the case control study. Bujhiyela? Now I will repeat it again.
बुझिए
Repeat it again, ma'am.
Yes, case control study. So I already discussed about that. What is case and what is control in case control study? It's the type of observational analytical study. Okay, ମୁଁ କହିଥିଲି analytical study, the observational analytical study in which the researchers mainly uses the subject who already have a disease and other condition and look back to see if there are the characteristic of the subject that differ from those who don't have the disorder. That is called as the what? Case control study. All of you understood?
Yes, ma'am.
Yes, ma'am.
All of you clear about the case control study?
Yes.
Yes, ma'am.
Yes, ma'am.
Sridhar 3, are you understood?
Yes, ma'am.
Okay. ସେଠି କିଛି କରିବେ କେବେ ଖାଲି ବସିବେ ନା okay. In the case control study, mainly the use the subject who already have a disease or other condition and look back to see if there are characteristic of this subject that differ from those who don't have that disease problem. That is called as the case control study. And in this type of study, mainly case control study is the identification by the researcher of an outcome or the effect. That means lungs cancer, otherwise the heart disease. If we will consider about the anemia, a numbers of potential causative factor is responsible for that. And if investigating the lung cancer, for example, the factor selecting might include the smoking history or asbestos exposure, they are very prone towards the carcinoma. Okay, and a number of control subjects are then chosen who do not exhibit the outcome or the effect under the investigation, and there may be one or more per cases subject. These controls should match the cases as close as possible with respect to the risk variables. Now I will discuss about the analytical cross-sectional study. This analytical cross-sectional study means the descriptive cross-sectional study, which is a thought of the providing a snapshot of the frequency and the characteristic of the diseases. जोटा मु कही descriptive cross-sectional study रे mainly गोटे snapshot देदब of the frequency, केते frequently disorder होचे and what is the symptoms, what is the characteristic of the diseases in a group of population at a particular point in time in analytical cross-sectional research design, and the status of an individual with respect to the presence or the absence of both exposure and the disease is assessed at the same point in the time. And these analytical cross-sectional study mainly differ from solely descriptive cross-sectional study in that they compare the proportion of exposed person who are diseased with the proportion of the non-exposed person who are not the disease. ମୁଁ ଆଗରୁ ମଧ୍ୟ କହିଥିଲି ଏଠି mainly they will compare the analytical cross-sectional study. This differ from that solely descriptive cross-sectional study in that they compare the proportion of the exposed person who are the disease with the proportion of not exposed person who are the disease. That is the analytical cross-sectional study. And mainly this type of cross-sectional design is particularly well suited to acute condition. That means when the disease will be start and with a short latent period, such as the typhoid or the measles, or those in the chronic disease that are not fatal. Means congenital malformation. Congenital means এটা ଗୋଟେ chronic disease ହେଇଥିବ but it is not fatal. Fatal means କ'ଣ? Fatal means dangerous. ବୁଝିହେଲା? ଯେମିତିକି ମନେକର congenital
Dangerous.
congenital mal deformity means କ'ଣ? What do you mean by congenital mal deformity? ଯୋଉଟା ଜନ୍ମଗତ ଯୋଉ
Deformity present from birth.
that is called as the congenital. बुझिला जोटा बात समय जोटा आम नहीं के आसथिबा सेटा तो ऑलरेडी जोटा हे जाइछि सेटा हे जाइछि तार तो किछि एते साइड इफेक्ट तार किछि एते कॉम्प्लिकेशन हबार नाही दैट टाइप ऑफ डिजीज इज कॉल्ड एज द chronic disease not comes under the fatal disorder. And this analytical cross-sectional study is the mainly generally considered a rapid and an expensive way to provide the clues for further and the more valid investigation. Okay, this is all about your analytical cross-sectional studies. Now I will discuss about the what is the experimental and the interventional study. It's very important. What is the experimental and the interventional study? In this experimental study, the observational and or the experimental or the interventional study, the experiment is and the investigation of the effect of a deliberate intervention or a stimulus so as to change the course of the event. What is the experimental study? In the experimental study is an investigation of the effect. Cause and effect of the effect of a experiment of a deliberate intervention or a stimulus so as to change the course of the event. That is called as the what? Experimental study. But in the interventional study, the intervention tries mainly the therapeutic or the preventive or the rehabilitative. That is called as the intervention study. After disease ପରେ ଆମେ ଯୋଉଡାକ precaution ନଉଛନ୍ତି କିମ୍ବା ଯୋଉ therapeutic part ଟା ରହୁଛି କିମ୍ବା ଯୋଉ preventive part ଟା ରହୁଛି that is called as your intervention. Intervention trials or the therapeutic or the preventing or the rehabilitative study. These therapeutic trials are mainly conducted among the patient with a particular disease to determine the ability of the agent and the drugs and the supplement or the medication or the diet or a procedure to diminish the symptoms. Why we are using the therapeutic diet? Because if we will implementing the therapeutic diet, then only we not only medication will be cure the disorder. Along with the medication, if we will be start some supportive therapy like the diet therapy, so it will be increase the what? It will increase the healing power of the patients. And this therapeutic, that the intervention or the trials can be therapeutic or the preventive or the rehabilitative. ଏଇଟା ଯୋଉ ମୁଁ କହୁଛି ଆପଣମାନଙ୍କୁ ଏଇଟା ହଉଛି ଗୋଟେ therapeutic part ବୋଲି ବି ଆମେ କହିପାରିବା because therapeutic trials are mainly conducted among the patient with a particular disease to determine the ability of the agent and the drugs, diet, supplements or a procedure to diminish the symptoms, prevent the recurrence or decrease the risk of death from the diseases also. Therapeutic trials if we देखिबा ताले मने करो if the patient is having the problem of the any kind of TB means that person is having the having the microorganism tuberculosis microbacterium tuberculosis must be there and that long term treatment and short term treatment randomly allocated. I mean long term treatment भी start करो यदि if the infection rate is very high na, at that time we will prescribe the long term treatment. If the infection rate will be very less, at that time we will choose the very short period of time we will give the some anti-diabetic drugs. So in the long term treatment, bacillus that that tuberculosis bacillus may be positive, maybe bacillus may be negative. In the short term treatment also the bacillus that microbacterium tuberculosis bacillus may be positive or the negative. In the preventive trials na जेमती कोविड है तो कोविड रे तो आमे जहाँ जितके लोक जो पॉजिटिवली हे गले जार वाइटालिटी जतिके थिले सेठो किछ जण रिकवरी कले अदरवाइज आमे ता परे भी आमे कोन होतले प्रिवेंशन नउथले तो प्रिवेंटिव ट्रायल्स ऑन द अदर हैंड इन्वॉल्व्स मेनली द इवैल्यूएशन of whether an agent or the substance or procedures reduces the risk of the developing diseases among those free from the condition at enrollment. ଯେତେବେଳେ ଆମେ ନଉଥିଲେ ବି ଭ୍ୟାକ୍ସିନେସନ କରାଉଛନ୍ତି ଆମେ ତେବେଳେ କ'ଣ କରୁଛନ୍ତି ଆମର जो एजेंट हो कि सब्सटेंस हो कि जो डिजीज रो जो पॉजिटिव ऑर्गेनिज्म हम बॉडी रे आगु को फर्दर किसी सिम्पटम्स डेवलप करूची ना करूनी जदि हमर भाइटालिटी जतिके अधिक अछि ताले हमर ए जो आमे जो प्रिवेंशन हिसाब रे नौचे सेटा मध्ये हम बॉडी रे बहुत भलो रेस्पोंड करबो हमर किसी प्रकार कोन ड्रग्स रो इफेक्ट पॉजिटिव हबो जो भी प्रिवेंशन पे आमे नेउचन सेटा हमर पॉजिटिव इंपैक्ट बॉडी रे पकेबो ଗୋଟେ ମିନିଟ୍ all of you have submitted your assignment
No, ma'am.
no or yes
No, ma'am.
No, ma'am. March 30 है.
your deadline is March 30
Yes, ma'am.
are you completed
କିଛି କିଛି ହେଇଛି ସବୁ ହେଇନି.
हाँ ଯାହାହେଲେ ବି ଲେଖି ଲେଖି କମ୍ପ୍ଲିଟ୍ କରିଦିଅନ୍ତୁ
ଆଜ୍ଞା ହଁ ସରିଯିବ.
ବୁଝିହେଲା ନା ଏମିତି ଏମିତି କିଛି ନୁହଁ ଏତେ ଲେନ୍ଦି ଲେଖିବା ବିକଜ ମୁଁ ଦେଖୁଛି ମାନେ ବହୁତ ସାରା ପିଲାମାନେ ଆପଣମାନେ କଣ କରୁଛନ୍ତି ମାନେ ଆନ୍ସର ମାଗିଥିବ 5 ମାର୍କସର ବଟ୍ ଆପଣ ଲେଖୁଛନ୍ତି 5ଟା ପେଜ 4ଟା ପେଜ ନୋଟ୍ ନିଡ୍ ଟୁ ଏକ୍ସପ୍ଲେନ୍ ବ୍ରିଫଲି ଏତେ ସାରା ଲେଖିବା କିଛି ଆବଶ୍ୟକ ନାହିଁ ଯେତିକି ଦରକାର ଆମେ ସେତିକି ଲେଖିବା ଏମିତି ନୁହଁ ଯେ ଆପଣ 5 ପେଜ ଲେଖିଥିଲେ ବହୁତ ଅଧିକ ମାର୍କ ସିକ୍ୟୁର କରିବେ ବୋଲି understood now what I'm saying
Yes,
Yes,
ma'am.
ma'am.
3 marks क्वेश्चन पढ़ी था एंड पिला माने 3 पेज लिखुचंती इज इट रिक्वायर्ड
No.
No, ma'am.
so
No, ma'am.
why are you writing like this no need to explain very briefly you have to first you have to go through the marks okay कितने मार्क रो क्वेश्चन अछि देखिबा एंड अकॉर्डिंगली you have to formulate the answer understood
Yes, ma'am. Ma'am, first year ର କଣ practical ହେଲାଣି?
नहीं ଏବେ ତ ଆମର ସରିଲା ବୋଧେ ସେକେଣ୍ଡ ଇୟର ପ୍ରାକ୍ଟିକାଲ ସରିଲୁ ନା ଆମେ ଫାର୍ଷ୍ଟ ଇୟର ଏକ୍ସାମ ବି ତ ଲାଷ୍ଟ ସଣ୍ଡେରେ ସରିଲା ପିଲାମାନେ ଲାଷ୍ଟ ସଣ୍ଡେରେ ସେକେଣ୍ଡ ଇୟର ମୁଁ ସବୁଟା ପ୍ରାକ୍ଟିକାଲ ଆମର ମାଇକ୍ରୋ ବାୟୋଲୋଜି ଦେନ୍ ବାୟୋକେମିଷ୍ଟ୍ରି ଥିଲା ଆଡଭାନ୍ସ ନ୍ୟୁଟ୍ରିସନ ସବୁ ପିଲାମାନଙ୍କର ସରିଛୁ ଲାଷ୍ଟ ସଣ୍ଡେ ମିନ୍ସ ଆଜି ମଣ୍ଡେ ଟ୍ୟୁଜଡେ 2 ଦିନ ହେଇଛି ଲାଷ୍ଟ
Yes,
ଥର
ma'am.
ଥିଲା
ମୁଁ ସେଦିନ ଫୋନ କରିଥିଲି ଆପଣଙ୍କୁ କହିଲେ ଯେ ମୁଁ ଅଛି ଏକ୍ସାମ ପ୍ରାକ୍ଟିକାଲ ଏକ୍ସାମ ରେ ଅଛି.
Exactly. ସେଦିନ ମୋର କ୍ଲାसेस ବି ଥିଲା ତିନିଟାରେ and ସେଇମାନଙ୍କର ଏକ୍ସାମ ବି ମୋର ସରି
ମ୍ୟାମ୍
ନଥିଲା ସେ
ଆମକୁ
ସବୁ
ଆମକୁ ମେସେଜ ଆସିଥିଲା ନା 25th ରେ ଅଛି ଆପଣଙ୍କର ଯୋଉଠି କ୍ୟାନସଲ ହେଇଥିଲା
ହଁ ହଁ ସେଇଟା
ସେଇଟା
ମୋର
25th ରେ ଥିଲା
ଟେନସନ
ତ ମୁଁ 20 ମିନିଟ୍ ୱେଟ୍ କଲି ତାପରେ ପୁଣି ଆପଣଙ୍କୁ ଫୋନ କଲି ଆପଣ କହିଲେ ଆଜି
ସେଥିପାଇଁ
ହେଇପାରିବନି ମୁଁ ଅଛି
ଏକ୍ସାମ
ପ୍ରାକ୍ଟିକାଲ କ୍ଲାସ।
ଦେଇକି ହଁ ହଁ ତ ଆପଣ ମାନେ ଲେଖି ଦିଅନ୍ତୁ ଆସାଇନମେଣ୍ଟ ଯାହା ଅଛି ଲେଖି ଦେଇକି ସବମିଟ କରିଦିଅନ୍ତୁ ଏତେ ଲେନ୍ଦି ଲେଖନ୍ତୁ ଏତେ ଆବଶ୍ୟକ ନାହିଁ ଏତେ ସମୟ ସେଇଥିରେ ଦବା ଅପେକ୍ଷା ସେତିକି ସମୟ ଯଦି ଆମେ ଥିଓରି ବି ପଢିବା ବହୁତ ଆପଣଙ୍କ ପାଇଁ ହେଲ୍ପଫୁଲ ହବ ଫର ୟୋର ଥିଓରି ଏକ୍ସାମ ଓକେ।
ମ୍ୟାମ୍ ତଥାପି ପ୍ରାକ୍ଟିକାଲ ଫାର୍ଷ୍ଟ ଇୟର ସରିଗଲା ଆମେ ଜାଣିପାରିଲୁନି ତ।
କିଛି ପ୍ରାକ୍ଟିକାଲ ହେଇନି?
ନାଇଁ ମ୍ୟାମ୍ କିଛି କରିନୁ ସେମିତି କିଛି ମେସେଜ ବି ଆସିନଥିଲା ତ ମୁଁ ଭାବିଲି ଖାଲି ଥିଓରି କ୍ଲାସ ଚାଲିଛି।
ସେକେଣ୍ଡ ଇୟର ହେଇଯିବ ସବୁତକ ଫାର୍ଷ୍ଟ ଇୟର ସେକେଣ୍ଡ ଇୟର ଆମେ ଗୋଟେ ଥର ନେଇଯାଉଛୁ ଏଥର ତ ଆମେ ସେମିତି ହିଁ କରିଥିଲୁ।
ନାଇଁ
ବୁଝିହେଲା
ମ୍ୟାମ୍ ଆମର ଫାର୍ଷ୍ଟ ଇୟର ମାନେ ଜୁଲାଇ 2023।
admission your admission ସେ ସମୟରେ ହେଇଥିଲା?
ୟେସ୍ ମ୍ୟାମ୍ ଜୁଲାଇ 2023 କିନ୍ତୁ ନଭେମ୍ବର ଯାଏଁ କିମ୍ବା ଡିସେମ୍ବର ଯାଏଁ ଚାଲିଥିଲା ଆଡମିସନ ଚାଲିଥିଲା ତ ଆମେ ଡିସେମ୍ବର ଲାଷ୍ଟ କୁ ଜାଣିଲୁ ଯେ ଆମେ ମାନେ ଆଡମିସନ ହେଇଛି ତ ଜାନୁଆରୀଠୁ କ୍ଲାସ ହବ ଜାନୁଆରୀ 15ରୁ କ୍ଲାସ ହେଲା।
You do one thing, you can directly talk with the regional center. Akuru sir is there now, otherwise Tapman sir is there, but I think that Akuru sir is handling all these things. Understood
ୟେସ୍
now?
ମ୍ୟାମ୍ ମ୍ୟାମ୍
Akuru sir
ଯଦି ମିସ୍ ହେଇଗଲା ତାହେଲେ ନେକ୍ସଟ ଆମେ କରିପାରିବୁନି? ମାନେ ପ୍ରାକ୍ଟିକାଲ ଟା ଏବେ ଯଦି ଆପଣ କହୁଛନ୍ତି ଫାର୍ଷ୍ଟ ଇୟର ନେଇ ସାରିଲେଣି ତାହେଲେ ଆମେ ମାନେ ଆଉ କରିପାରିବୁନି ନେକ୍ସଟ ଫାର୍ଷ୍ଟ ଇୟର ପାଇଁ?
ନା ମୁଁ ସେ ଫାର୍ଷ୍ଟ ଇୟର କଥା ମୁଁ କହୁନି ମୁଁ ତ ଏବେ ସେକେଣ୍ଡ ଇୟର ମାନଙ୍କର ତ ମାନେ ପ୍ରାକ୍ଟିକାଲ ଆମେ ନେଇଥିଲୁ ବୋଧେ ମୁଁ ଲାଷ୍ଟ କେବେ ଲାଷ୍ଟ 20 ଦିନ କି ଆର ମନ୍ଥରେ ବୋଧେ ନେଇଥିଲି ଏବେ ତ ତାଙ୍କର
ୟେସ୍ ମ୍ୟାମ୍
ଏକ୍ସାମ ହେଇ
ଆପଣ ମିତାଲି ମ୍ୟାମକୁ ପଚାରୁଥିଲେ ନା ପ୍ରାକ୍ଟିକାଲ କ୍ଲାସ କରିଛନ୍ତି କି ନାଇଁ ସେ କହିଲେ ନାଇଁ ମ୍ୟାମ୍ ମୁଁ ଫାର୍ଷ୍ଟ ଇୟର ତ ଆପଣ ସେତେବେଳେ କହିଥିଲେ ଯେ ସେକେଣ୍ଡ ଇୟର ଚାଲିଛି ପ୍ରାକ୍ଟିକାଲ।
ହୁଁ। ଆପଣ ସେ କରିବେ ଆରେଞ୍ଜ କରିବେ ଆପଣ ମାନେ ଆଉ ମୁଁ ଆପଣ ମାନଙ୍କୁ ସମସ୍ତଙ୍କୁ କହୁଛି ନିହାତି ରୂପେ ଥିଓରି ହଉ କିମ୍ବା ପ୍ରାକ୍ଟିକାଲ ହଉ କ୍ଲାसेସକୁ ନିହାତି ରୂପେ କରନ୍ତୁ ୟାକି ଏଇଟା ଗୋଟେ ପଜିଟିଭ ଇମ୍ପାକ୍ଟ ଆପଣ ମାନଙ୍କ ପାଇଁ ହେଲା।
ୟେସ୍ ମ୍ୟାମ୍।
Okay. So today I already discussed about the analytical study of the epidemiology, and this is also a very important chapter. And this analytical study is the comparative study, and in this analytical study, we have to use the comparison between the groups among the population, intended to identify and quantify the association. Test the hypothesis. Hypothesis is nothing. Hypothesis is the supposition or the assumption. Okay. In contrast to the hypothesis formulation and identifies the cause, the determinants. And the various types of analytical studies which can be carried out includes the observational study and the experimental study. I already briefly described about what is the observational study and what is the experimental study. And the objective of what is the main objective of the core study? The main objective of the core study is to mainly observe a large numbers of population, a large group of people over a periods of time to test the hypothesis regarding the cause of the diseases. And this example of the core study based on your review of the journals or the reference book or the internet. This is the example of the core study. ଆମେ ଏଟାକୁ ନ ନେଇକି ମୁଁ କହିଥିଲି କୋର୍ସ ଷ୍ଟଡିରେ ମେନଲି ଆପଣମାନେ ଦେଖିବେ ଏଠି ଆମର ଯେହେତୁ ଏପିଡେମିଓଲୋଜି ବାବଦରେ ଆମେ ଆଲୋଚନା ମାନେ ଚାଲିଛି ଡିସ୍କସନ ଚାଲିଛି ତ ଆଇ ୱିଲ୍ ଗିଭ୍ ଦ ଏକ୍ସାମ୍ପଲ ଅଫ ଏପିଡେମିଓଲୋଜି ଓନ୍ଲି ତ ସେଥିରେ ଆମେ ଡିଜିଜ ଯେତେବେଳେ ଆମକୁ ହଉଛି ତାଠୁ ପାଷ୍ଟକୁ ଯିବା ତାର କଜ କ'ଣ ତା ଇଟିଓଲୋଜି କ'ଣ from that to up to the disease period that is called as the cohort study. All of you clear?
Yes, ma'am.
What is the interventional study? The interventional study are most like in the experimental study, and these interventional study they provide the strongest evidence for the causality in the relation to the temporarily and control for unknown co-foundation. In fact, that they can provide the strongest and the most direct epidemiological evidence on which to make a judgment about the existence of the cause effect. I already discussed about what is the cause and what is the effect relating. They also fulfill the basic assumption of the statistical hypothesis. This is all about your analytical study. Then today I will discuss about the next unit is our issue in the design and the conduct of the selected epidemiological research and the design. What is that descriptive research? What do you mean by research? You tell me the definition of research. Sridhar 3, what do you mean by research?
It is a systematic and organized effort to investigate about a new finding or a problem or finding a new solution in a creative way to a problem.
What is research means what? Re means what?
Then again searching about the same
Yes,
problem.
yes, very good.
Search again and again.
Again,
Yes, ma'am.
ଖାଲି ଏମିତି ନୁହଁ ଯେ ପୂର୍ବରେ ଯାହା ରିସର୍ଚ୍ଚ ମିନ୍ସ ଆମେ ଖାଲି ପୂର୍ବରେ ଯାହା ଅଲରେଡି ହେଇକି ଅଛି ତାକୁ ଆମେ କଲେକ୍ଟ କରିବା ଡାଟା ଇଟ୍ସ ନଟ୍ ଦ ରିସର୍ଚ୍ଚ ରିସର୍ଚ୍ଚ ମିନ୍ସ ପ୍ରିଭିୟସଲି ଯୋଉଟା ଅଲରେଡି ରିସର୍ଚ୍ଚ ବେସ୍ଡ ଅଛି ତାକୁ କଲେକ୍ଟ କରିବା ଏଣ୍ଡ वी हैव टू फॉर्मुलेट द कलेक्टिंग द न्यू डाटा एंड न्यू रिसर्च थिंग्स वी हैव टू इम्प्लीमेंट बुझिल ना नहीं पूरा पुराना
Yes,
ଯାହା ଅଛି ତାକୁ ନବା एंड न्यू କିଛି ଆମର collection ରୁ ଆମେ ତାକୁ implement କରିବା that is called as the research. Okay, what is the descriptive research? And mainly in the aim of the descriptive research is to describe the what exists with respect to the variables or the condition in a situation. Variable, what do you mean by variable?
ma'am,
What
which
is variable?
varies, which value varies.
ଭେରିଏବଲ୍ସ ମିନ୍ସ ଆମେ ସିମ୍ପଲ ଜିନିଷ ଯେତେବେଳେ ଆମେ ରିସର୍ଚ୍ଚ କରିବା ଗୋଟେ ଡାଟା କଲେକ୍ସନ କରିବା ତ ଡାଟାରେ ଗୋଟେ ଗ୍ରୁପ ଅଫ୍ ପପୁଲେସନରୁ ଆମେ ଡାଟା ନେଉଛନ୍ତି ତ ସେଠି ଯୋଉ ଡିଫରେଣ୍ଟ ଟାଇପ୍ସ ମନେକର ମୁଁ 1 ରୁ 10 ନମ୍ବର 10ଟା ପେସେଣ୍ଟର ଡାଟା ନେଇଛି ତ ନମ୍ବର 1 ନମ୍ବର 2 ନମ୍ବର 3 ନମ୍ବର 1 ରାମ ହେଇପାରେ ନମ୍ବର 2 ଶ୍ୟାମ ହେଇପାରେ ନମ୍ବର 3 ରାଜୁ ହେଇପାରେ ତ ରାମ ଗୋଟେ ଭେରିଏବଲ୍ସ ରାଜୁ ଗୋଟେ ଭେରିଏବଲ that is called as the variable of the research work. Understood?
Yes, ma'am.
Yes, ma'am.
Rakesh, are you clear?
Yes, ma'am.
Okay. In the descriptive research methods is mainly appropriate in the behavioral science. And many types of behavior that interest the researcher cannot be arranged in a realistic setting. And for example, it would be unthinkable to prescribe the cigarette smoking for the purpose of studying its possible relationship to throat or the lung cancer, and deliberately mainly arrange the accident in order to evaluate the effectiveness of seat belt or the helmets in the preventing the serious injuries. This is the descriptive research. And some experimental studies now of a human behavior can be appropriately carried out both in a laboratory and in the field also. The prevailing methods used in the society science is descriptive under the condition that naturally occur at home and home. And the human's behavior can be systematically examined and analyzed also. And what is the main step of the research? এটা ବହୁତ ଇମ୍ପୋର୍ଟାଣ୍ଟ ସବୁବେଳେ ହିଁ ଇମ୍ପୋର୍ଟାଣ୍ଟ ଆଣ୍ଡ ଯଦି ଆପଣମାନେ କିଏ PhD କରିବେ ତ ସେମାନଙ୍କ ପାଇଁ ବହୁତ ଇମ୍ପୋର୍ଟାଣ୍ଟ ହ୍ୱାଟ ଇଜ ଦ ମେନ୍ ଷ୍ଟେପ୍ ଅଫ୍ ଦ ରିସର୍ଚ୍ଚ mainly first examine the problematic situations. What is the problematic situation? First you have to examine that, and after that you have to define our problems and state our hypothesis also. Okay, and list the assumption upon which our hypothesis and the procedure are based. You have to list out the assumption upon which your hypothesis and the procedure are mainly based, and select the appropriate subject and the sources materials also, and select or construct the techniques for collecting the data, how to collect the data and from where to collect the data and what tools you have to use for the collection of data. All these things are very vital. And validate the data gathering techniques and make the objective and discriminating observation, describe the analyze and interpret our data in very clear precise term. एमती नुह जे जितेबाला आमे जहाँ भी आमे रिसर्च पाई जो मेन स्टेप आपण मु जो गोटा भी आपण मानक असाइनमेंट पाई कहूतली 50टा पेज लिखिदेले आपण को जी भी एग्जाम में 50 मार्क एक्स्ट्रा दे दबो बिल्कुल नुह while you are formulating the research plan now you have to you and that precise form and it's very clear and I mean इत्यादि मेंचे गुड़ा ये सब लिखिबा दरकार ने अल्प पछी लिखिबा but you have to write down the effective points. And second point is the collection of data. I already discussed about it. The collection of data for the research is very vital. How to collect the data and where to collect the data and what is the tools and techniques you have to use for the collection of data. These three things are very vital for the collection of the data. From where you have to collect the data? From the total population you have to collect the data or the sample population also. Total population means obtaining the information from every unit of small population is not difficult in most instance, but the findings are not applicable. Patient Hello. Am I audible to everyone?
Yes, ma'am.
Yes, ma'am.
Just wait for 2 minutes. I will be joined. I'm here. Just wait for 2 minutes. Okay.
Okay, ma'am.
ଔଷଧ ଯେମିତି ଲେଖିଛନ୍ତି ସେମିତି ଖାଇବେ ଆଉ ହେଲା for the research na collection of data is very important, and for the collection of data you have to collect the data from the population total population. Mainly obtaining the information from every unit of the small population is not difficult in most instance, but the finding are not applicable to any population other than the group studies. You have to collect the data from the total population and the sample population. Sample population means obtaining the information from a large population, such as all mothers in a state, or is often impractical, impossible, or extra arbitrary, costly also. And contacting, observing, measuring, or interviewing every unit in a group may absorb so much time that the data becomes obsolete before the study is complete. And to overcome these difficulties, investigators often collect the information from a view very carefully selected units draw from the population. ସେପଟେ ତାଙ୍କୁ ଡାକନ୍ତୁ ଅଛନ୍ତି ସାର୍. And while you have to collect the data na, you have to choose the many large population ଯଦି ଆମେ data ନବା ତାହେଲେ ଆମ research ଟା ସେତିକି ଠିକ ହେଇପାରିବ without any error. In the what is the correlational study basic issue? In the correlational study, mainly the correlational study are generally intended to answer mainly there is a relationship between the two variables or two sets of data. If the answer to this question is if there is the relationship between the two variables, then two other question like the what is the direction of the relationship? Mainly you have to find out the what is the relationship between these two variables and what is the magnitude of the relationship of these two variables. And the magnitude of the relationship is determined by the coefficient of the correlation. Okay, the magnitude of the variables depend magnitude of the relationship is mainly depends upon the determined by the coefficient of the correlation. Case study method. What is that case study method? Case study method is the mainly is the case of studies on the communities, a village or the tribal area or the slum area or particularly group of people. Each can be considered the unit of investigation. Okay, understood what is case study method? The case study method case study on the communities or the very large population from the large population or from a village or from a tribes or a slum area or particularly group of people, each can be considered the unit of investigations. And what is the purpose of this case study? The main purpose of the case study are mainly conducted with the very clinical purpose, and they are treated as the diagnostic and the prognostic measure for the client treatment. And this approach is a psychotherapeutic background. What is the main purpose of the case study? The chief purpose of the case study are the conducted with the clinical purpose, and they are mainly treated as the diagnostic and the prognostic measures for the client treatment, and this approach is the psychotherapeutic background also. And the main purpose of this case study, usually the case study are conducted for the developing a deeper understanding about the intricate relationship existing in the process aspect of a specific unit through the intricate relationship and that units through the qualitative investigation. What is the characteristic of the case study method? The main characteristic of the case study method is the completeness, authenticity of the data, confidential recording, and the intellectual synthesis, continuity in investigation. These all are the main characteristic of a case study. ଆପଣମାନେ ଦେଖିଥିବେ ଯେତେବେଳେ ଆମେ ଯେକୌଣସି ହସ୍ପିଟାଲରେ ଆମେ ପ୍ରାକ୍ଟିସ କଲାବେଳେ ଯେତେବେଳେ ଗୋଟେ କିଛି ଜିନିଷରେ ଆମେ ଗୋଟେ ଡେଜର୍ଟେସନ ବି ଆପଣମାନେ ପ୍ରିପେୟାର କରିବେ ପ୍ରୋଜେକ୍ଟ ୱାର୍କ ଯୋଉ କରିବେ ଆମେ କ'ଣ କରିବା ସେଠି ଗୋଟେ କେସ୍ ଷ୍ଟଡି ବନେଇବା। କେସ୍ ଷ୍ଟଡି ମାନେ ପର୍ଟିକୁଲାର ଗୋଟେ ଡିଜିଜ କିମ୍ବା ଡିସଅର୍ଡରକୁ ନେଇକି ଆମେ ଗୋଟେ କେସ୍ ଷ୍ଟଡି ବନେଇବା। ତ ସେଇଠି ଆମର ପର୍ଟିକୁଲାରଲି ଆମେ କେତେଟା 30% ହଉ 100% ହଉ ତାଙ୍କୁ ନେଇକି ଆମେ ଅବଜରଭେସନରେ ଆମେ ତାଙ୍କୁ ରଖିକି ଆମେ ଦେଖିବା। तो व्हाट इज द चीफ कैरेक्टरिस्टिक ऑफ द केस स्टडी सेटा होची आपनकर केस स्टडी जो प्रोजेक्ट वर्क जो करिवे हॉस्पिटल रे दैट इज योर केस स्टडी एंड व्हाट इज द कैरेक्टरिस्टिक ऑफ ए केस स्टडी मेनली कंप्लीटनेस जो केस स्टडी आपण बनेथिबे दैट शुड बी इन ए कंप्लीट फॉर्म ए साउंड केस स्टडी मेनली मींस दैट ए गुड केस स्टडी इट इंक्लूड्स द mainly extensive collection of the data and that data concerning internal as well as external environment of the unit under study and that collection continues till the completeness of the data is ensured and the complete pictures of the unit emergencies. एमती नुह जे आपण जितबले भी प्रोजेक्ट करूछंती डाटा माने 30% रो कोनसी प्रकार गोटे डिजीज स्पेसिफिकली किछि करूछंती तो एटा नुह पॉसिबल ओनली वी विल कलेक्ट द डाटा फ्रॉम द हॉस्पिटल साइट ओनली बियॉन्ड द हॉस्पिटल आल्सो यू कैन कलेक्ट द डाटा। अंडरस्टूड बुझी होची ना?
Yes, ma'am.
And that confidential recording, what is that confidential recording? The confidential recording means the necessary data mainly involving the personal and the ethical issue like the relationship on the Anganwadi worker with the beneficiary. And the confidential records, documents about the institution, etc., must be handled carefully, and every care must be taken to maintain their secrecy. ओके जदि मनकर आम एमडीएम प्रोजेक्ट को लेकिन मुझे कहले हॉस्पिटल रे भी आम प्रोजेक्ट करि परिबा कि आम जदि पब्लिक रो पब्लिक फोरम को लेकिन मध्य आम करि परिबा काली बोधी क्लास रे कहउतली सेटा तो जदि आम पब्लिक रो किछि डाटा कलेक्शन करूछन्ते जेमति कि माने एमडीएम प्रोग्राम को लेकिन कि आईसीडीएस प्रोग्राम को लेकिन जदि आम किछि करूछन्ते तो इन दैट केस वी विल कलेक्ट द डाटा फ्रॉम द वे फ्रॉम द community only, and who will be give us the data? Mainly our anganwadi worker or any asa didi, se mane humko help kariba. So whatever they will be submit the data near us now, we have to keep it in the very confidentially. We will not open to everywhere. Okay, and I mean say data को निहाती रूपे जे कौन सी, not only I am saying about the माने जदि आम बाहर डाटा नौ आम हॉस्पिटल रू भी, कारण बहुत जन पेशेंट थांती तांका सबुतक पर्सनल इश्यू को से माने पर्सनली ही रखिया पय चाहते, केबे मध्ये कि को यूनिवर्सल शेयर करिया पय चाहते नै. तो बीइंग ए रिसर्चर यू हैव टू मेंटेन सीक्रेसी. अंडरस्टूड? आसुन सर आसुन खाया पय चाहूचंती. हां हां खांतु मंजीटा जदि जूस कर दियंतु, पानीटा पियंतु, मंजीटा फोपाड़ी देबे. हां मंजीटा टिके डाइजेस्ट हबनी एबे. ओके हां हाँ खाइबे किसी असुविधा नहीं, बट मंजी खाइबे ना, ताको स्टेन करके जो जूस बनेबे ना ताको छाणी के खाइबे. हैला हां नमस्कार. That's your case study keep in the very confidential recording, and the completeness should be there. That means a sound completeness should be there, and confidential recording in, along with that intellectual synthesis. Intellectual synthesis means since a case study involves mainly multi-method inquiry and deals with all significant situations concerning the unit, appropriate synthesis of the data is necessary to depict the uniqueness of the unit and to explore the significant relationship. This intellectual synthesis is also very important for the case study. And authenticity of the data. That means a report of the case study must be based on the meaningful, reliable, and the valid information regarding the cases. Several qualitative and the quantitative techniques such as the interview method. There are so many methods of the data collection that may be interview method. That interview method means you have to ask the question, you have to sit in front of the means that from where you have to collect the data. First you have to sit in front of that person, and you have to directly ask the question related to that problem or related to your research based question you have to ask. That is called as the interview method of techniques for the data collection. Observational method of data collection means you have to no need to ask anything to the patient or anything to the client about the research work. You have to look at the client, and you have to only observe the patient, and after the observation you can got the maximum information about the research work. Okay, and record survey and administration of the test questionnaires also, and find their appropriate application in case studies. Use of the multi-techniques approach to data collection and cross-examination of the data through the different techniques can take care of the authenticity of the data also. And continuity in the investigation. Our जहाँ भी हमें case study नौचंदी, we have to continue that one. Continuous and the prolonged inquiry about the situation is necessary till the underlying the factors are explored and the plausible patterns of their interaction relationship identified. For example, the problems underlying the failure of nutrition education programs cannot be explored in one go. A researcher may have to undertake the prolonged inquiries. This is all about the characteristics of the case study method. First one is your continuity in investigation, completeness must be there, authenticity of the data, and confidential, you have to maintain the confidential records, and intellectual synthesis. Case study, the main step of the case study. how we will do the case study. First, you have to selection of a case for the investigation. प्रथमे आमे जो भी रिसर्च करिबा जहाँ भी करिबा first we have to select one topic. Without choosing one appropriate topic, then how will proceed towards the research work? ठीक ना नहीं?
Yes, ma'am.
So selection of a case for the investigation is very vital. The first step in any case study in the identification and the selection of case for the investigation, it mostly depends on the basic questions of the researcher, and that is very vital. And data collection. Second step is the data collection. How to collect the data. Then we will move towards the data collection. In the process of collecting the benchmark data about the cases, we may make use of both qualitative method of data collection and the quantitative method of data collection. Okay, like in this qualitative method and the quantitative method in the later class, I will discuss about what is the qualitative method of data collection and what is the quantitative method of data collection. In both the methods, we have to collect the data. In these two methods of collection of the data, we use the different types of that observational method and the interviews method and checklist method, pro forma method, open-ended question. You may ask the open-ended question. The open-ended question means that question must be end either yes or no. That is called as the open-ended question. And the close-ended question is also there. Interview method is there. Record survey, clinical test, etc. That means while you have to collecting the data, you have to implement all these things. You have to, for the collection of data, the process of collecting the benchmark data about the case, we may make use of the both the procedure. You have to use the qualitative method and the quantitative method. In this, both the qualitative method and the quantitative method, you have to collect the data by the observation, by the interview, by the checklist, by the pro forma, by the open-ended question, by the record survey, clinical test, etc. Every care must be taken to use the tool specifically relevant for the cases also. And third one is your analysis of the first round data. After the collection of the data, you have to analyze the data properly. Through systematic analysis of the first round data, we can identify the more complicated situation or the problems and the raise pertinent questions about the influential factor. In the case of the clinical investigation, this is about the solution to the problem also. This is the analysis of the first round data. Then you have to proceed towards the second round investigation of the data. In the second round investigation of the data, mainly is conducted for only those specific questions or the factors which are identified through the analysis of the first round data. Okay. And that intensive investigation about this specific issue or the problem are conducted through the prolonged observation. After that, you have to proceed toward the introduction of the alternative measures. Introduction of the alternative measures means in the case of the clinical study, the most suitable alternative or hypothesized through the investigation are introduced as the first stage. That is the introduction of the alternative measures. And the last step of is the follow up the activities. It's very vital. Follow up the activities means investigations should be made regarding the effectiveness of the alternative measures introduced. And such investigation gives us the feedback on the strength and the weakness of the corrective measures. This is the all about your follow up the activeness. This is all about your case study. What is the step of the case study for the collection of the case study? First one, the selection of the case of the investigation, and second one is the data collection. In the data collection method, you can use the different types of data collection method that may be in the qualitative method, and also in the quantitative method we also collect the data. In the both in the qualitative and the quantitative method of techniques of data collection, in where you have to observational method is there, interview method is there, and also some questionnaire method is there, pro forma is there, open-ended question you can ask. Through that also you can collect the data. And analysis of the first round data, second round investigation, and the introduction of the alternative measures in the follow of the activities. These all are the main case study steps which we are using during the preparation of the case study. And another one is your observational study. What is that observational study? In the observational study are made, but investigators do not control the exposure or intervention and other factors also. Cohort study, case control study, and the cross-sectional study are the main observational study. These three types of study are comes under the observational study. One is the cohort study. I already discussed about the cohort study, what is case control study, and what is your cross-sectional study. Now I will discuss about the design of the case control study. What is the design of the case control study? The design of the case control study, first we have to defining the disease or the outcome of the interest. Second point is the selection of the cases. Selection of the cases is also very vital, and the selection of the controls. I already told about what is control and what is case, and deciding the number and the manners of selection of the cases and the control also, and ascertainment of the disease and the exposure status. This is all about your what? Observational study and the design of the case control study. In the design of the case control study, first you have to defining the disease or the outcome of the interest. That means the first issue is to consider in the design of the case control study is to define the disease or the outcome of the interested. It's very important that we define the disease outcome as far as the possible as homogeneously entity since very often. It is the defining the disease or the outcome of the interest. Tomorrow I will briefly discuss about the what is the observational study and what is the issue in the design of the case control study. With aji time ହେଇଗଲାଣି, in the next class I will discuss about the observational study. Okay. ଆଜି ଯାହା ବି ପଢେଇଲି, all of you go through the subject properly because it's very vital. If you are having any doubts in the next class, you can ask me.
Yes.
Okay. Okay.
Okay, ma'am.
Thank you. Thank you.
Thank you.
Thank you, ma'am.
Welcome.